unless we rebuild trust, we are not going to be able to provide the health system actors with that confidence and security to transform and to take health systems into the next era. We often ignore health professionals. Health professionals are really the drivers. They can drive change or they can oppose change. And this is where, for example, when we talk about digital, we need to ensure that digital works for and with the health professionals. But I hear far too many stories of digital solutions implemented in such a way that actually denies agency and ends up overburdening health workers rather than gifting them time. The whole digital information system has also fueled much mistrust, and people are no longer able to understand sometimes what is real, what is true, and what is fiction. We know now that AI and devices can produce equally good results, if not superior results, to humans. But do you want to get the news from a computer screen, or do you want to get the news from a human person?
Hello everyone, welcome back to the show. Today's guest is someone who's very special for us. She's a woman leading conversations in the public health ecosystem. Dr. Natasha Azzopardi, who's doing an amazing role at the World Health Organization. You've been in different scenarios of the health ecosystem. So you've been in as a professor, you've been also as a student. You started as a student, and now you are leading in a global stage. You are representing 53 countries, not only Malta. What is this journey so far? Why did you decide to leave a bit the hospital environment and jump into a global scenario?
So I'm very glad that I qualified as a doctor, because the opportunity to practice medicine shapes at our core many decisions. And I see this in the clinical professionals who I work with, whether they've branched off now into administration, into IT. They still bring back that humanity that comes also from clinical practice. But I took a decision very early on. I think I was about 20 years old when I was very active already in student politics, international affairs, and then also some feminist groups in my youth. And I started becoming conflicted between whether I wanted to really work in a hospital as a practicing clinician, or whether I wanted to do politics, where you have the opportunity to change things for thousands of people at a go. And I always come back to the fact that I found my inspiration in the summer when I was studying in London. And I used to pace one of my favorite spots, Westminster Bridge, with the Houses of Parliament on one side, with Guy's and Tommy's Hospital on the other. And public health is really the bridge between the healthcare systems, the clinical work, and politics. And I think now for 30 years, I've been pacing that bridge.
Indeed. One of the topics that you've been strongly mentioning in different countries and conferences is trust, building trust on digital health and public health. So I want to talk a bit more about it because you mentioned three different, let's say, individuals in this trust conversation, which is the patient, of course, who is finding sometimes not the accessibility right to the public systems. Then in the other side, we have the worker who is also frustrated sometimes when the tools are not in there to serve the patient. And then you mentioned something very important, which is the investors as well, the investment part, right? When we try to see innovation playing as well in this mix, but then they don't see any return, or they don't see any action, or anything happening really and truly. So let's discuss about it.
So when we were working on our vision for health systems and the Tallinn conference, anniversary conference, which took place almost 2 years ago in Estonia, and it commemorated the 15th anniversary of the founding 2008 Talent Charter, which focused on the importance of bringing investment, health and wealth all together. We took a look at where the world is, where Europe is. And we came up with this concept that health systems need to transform. But health systems don't transform by magic, and not by technology either. It is people who drive transformation using the tools and the opportunities that become available to us. But for people to be able to drive transformation safely, they themselves need to feel safe and confident, and we found that broadly the missing element is trust. Now, this is not only unique to the health sector. This is part of a broader societal phenomenon where society has changed very, very quickly. People are finding it difficult to keep pace with the change. The whole digital information system has also fueled much mistrust, and people are no longer able to understand sometimes what is real, what is true, and what is fiction. So the concept is really quite simple, which is that health systems are having to invest a lot more and are somewhat stuck because of the lack of trust. Fundamentally, unless we rebuild trust, we are not going to be able to provide the health system actors with that confidence and security to transform and to take health systems into the next era. We often ignore health professionals. Health professionals are really the drivers. They can drive change or they can oppose change. And this is where, for example, when we talk about digital, we need to ensure that digital works for and with the health professionals. But I hear far too many stories of digital solutions implemented in such a way that actually denies agency and ends up overburdening health workers rather than gifting them time. So there are simple metrics that can be brought in to allow health workers to regain trust in change and transformation. When it comes to patients, patients are still very much often led by their health professionals, who are amongst the most trusted professionals in general. So if patients can sense that even their health professionals have become frustrated, despondent, cynical, that automatically will raise huge doubts about the safety of the system, the quality of the system, and whether it can be trusted within patients and the general population. And then, of course, we have to recognize that the spend on health and health systems in developed countries has continued to grow. This is not necessarily a bad thing. It's partly societal choice. But we need to become far better at being able to demonstrate the positive impact of the investment that is made. And given where we are in terms of priorities and fiscal constraints, we need to also become better at making innovation far more affordable and affordable to everyone globally.
Yeah, indeed. You mentioned two important things, and definitely I want to discuss it. One of them is also the policymakers, right? So when the ministers start with their execution, they come with a sense of emergency, right? So they need to solve so many things, and they start with the priorities. And some things that also can see a result fast, right? So sometimes public health becomes a bit on a side. You mentioned this in conferences in the past, and I want your vision. I want to see if you have if you have seen any changes since then. Are countries in developed or not acting towards this? Are they prioritizing public health when they start with the actually execution?
So This is a very important point, that we often like to say that ministers recognize the importance of public health at the end of their tenure. What I like to say is that I often see the fruit of my work 10, 15 years after I've done something. So, I mean, I was chief medical officer in this country over 10 years ago, and sometimes I see things happening that I can trace back to decisions that we took 15 or 20 years ago. So, public health is not always quick, but it doesn't mean that it is always not fast too. In this sense, for example, as WHO, at the beginning of the year, we published a compendium of what we call quick buys for NCDs, non-communicable disease control. This is an addition to our long-standing brief on best buys. But many politicians always seem to think everything in public health takes time to come to fruition. It's not necessarily the case. On the one hand, decisions that we take today to protect the health of our children under 5, early childhood development, are going to pay dividends when these people are 50, 60 and 70 years old. Of course, that is a long-term investment. But there are also decisions that can immediately start giving quick results. So it's a balance that needs to be put in place. And we need to acknowledge that as we grow older, which is of course a success story, we see that in many countries we have this gap between life expectancy and healthy life expectancy. And sometimes this gap is growing bigger as we become more successful at prolonging life, but not necessarily matching it by prolonging healthy life. Unless we are able to close that gap, that is where healthcare systems and the welfare states that we have built up since the Second World War in the past 80 years become threatened.
And in here, medical devices have a very important role as well. How fast we can see these changes as well with the help of AI or medical devices. And one of the problems as well is the workers who are actually directly using the devices and interacting with digital itself. And you mentioned something very important, which is women, for example. So nurses, they are not very much aligned with digital innovation. So what are you doing from your role in the World Health Organization to educate and to also try to raise the conversation? Maybe policymakers can do something about it as well.
So I think this is a temporary problem. I think the new generation all will be very digitally competent and equipped. But at the moment, if we take a snapshot of where we are at the moment, we have a situation where in many countries, the vast majority, for example, of caregivers, whether they are carers, nurses, but also many doctors in, for example, primary care, tend to be women and women of a certain age. So these did not grow up in the digital space. And here we see that there is often a gap or some resistance. And it is very important to ensure that we make these workers feel that they are confident and competent to use the technology, because otherwise they could resist its introduction. I came across a beautiful story. It's actually a good practice. It happened in Armenia, for example, where they had digital programs in schools, and then the grandchildren actually teamed up with grandmothers who were working as general practitioners, family doctors, to help support them to use and embrace the technology that was being made available. So every country can make it happen as long as you work with the people rather than trying to impose the change. Having said that, we also need to be very clear that nothing can replace the humanity of care. And I think that once this anxiety is gone and people understand that actually the technology is going to be a time saver and is going to help them with the scarcity of the health workforce, be able to do things faster, easier and better, it will start to turn around. And we see cases of this happening. But for example, let's take pattern diagnostics. Let's take, for example, breast cancer, right? We know now that AI and devices can produce equally good results, if not superior results to humans. Yeah. But do you want to get the news from a computer screen? Or do you want to get the news from a human person who is there holding your hand, providing comfort, and answering any very personal questions that may arise during that delicate moment? I think this is the balance that we need to get right.
Indeed. A challenge as well, since we are moving towards that. But we are actually in the area. Let's talk about the Europe and Malta as well, in medical devices adoption. So let's say, regulations. How do you see the space and the ecosystem overall, if you compare it with other bigger ecosystems, US or even Asia? Was Europe, taking on this scenario?
So I am very proud of where Malta is today. And let me give you a concrete example of when I was referring to earlier, sowing some seeds that then bear fruit later. It was at the time when we were preparing for EU accession, where Malta had to decide what it was going to do in terms of medicines regulation. There were other small countries, like Luxembourg at the time, that didn't have their own authority. We had taken the courageous decision back in 1999 and 2000, even though there were many stakeholders who were skeptical, that we were going to invest and we were going to build the capacity to set up a regulatory authority for medicines. 25 years later, this authority has now a very solid reputation across the European Union and beyond, and is also now recently become responsible for medical devices too. So I believe that as a small country, we are actually punching above our weight. This is due to the dedication, competence and expertise of people in public service that go beyond the call of duty. And we are agile and able to move very fast because we don't have too many bureaucratic layers. So this puts us in a very good position. Of course, I'm also very proud when I see an initiative like MedTech World, which has gone from Malta now to Europe and even globally. And I think that it's this confidence that we need to have that continues to help us to push forward. I believe that medical devices and technologies can be a powerful leveler and can be used to address inequity and can be used to empower patients if done right. Because I can see that a lot of young people now are taking far better control over their own health conditions using these technologies and becoming stewards of their own health. Yeah. And I think this is the way forward in health systems. Let's look at what has happened, for example, in banking, right? In banking, many years ago, people were quite passive recipients. Today, many of us manage most of our day-to-day banking transactions ourselves. I can see this also as one of the changes that will come into the health system when it comes to looking after one's own health, preventing, and particularly already we see it in place with people with chronic conditions who are using technology to be able to manage better their own health with the support, of course, of professionals, because nobody can be left alone to manage this.
Indeed. Dr. Natasha, to wrap up this conversation, I want to listen, what is the legacy that you want to leave to these new generations as a woman? Because you are doing an amazing job. These roles, women in medtech, in health tech and digital health are not a lot. So what is this message that you want to leave?
It can change. When I started in the health ministry more than 25 years ago, I was one of the only women. Today, the situation has really changed. When I started in a senior level government position, I remember we were appointed one director for every ministry, and I was the only woman out of 13. So things can change. It's not easy. So you have to be able to continually juggle. You have to be able to live with the realization that you will not be able to do everything as perfectly as you want to do it all the time. Mm-hmm. And you need to understand what is that top priority at that point in time. Is work the top priority and family needs to just wait a bit? Or is there something happening at home that is actually a priority that nobody else can deal with? And I need to be there in that moment myself. So I don't want to give the impression that it's easy, but it's possible. It is, of course, possible. And I would like every young person, but also speaking to young women particularly, to believe that we all have a talent. The important thing is really to discover what is your talent, what makes you burn, and to put that talent to use for the good of humanity.
Yeah. Thank you very much once again, and we hope to see you in MedTech events. Thank you very much.
Thank you.